Hi, I'm Gerard Banez. I'm a pediatric psychologist with Cleveland Clinic Children's school-based health clinics. And the focus of our webinar today will be the impact of COVID-19, coronavirus, on the behavioral health and wellness of students in our schools. For those of you in healthcare, those of you in education, these have been stressful months, and our primary concern today is on how the pandemic has impacted where kids are psychologically, where kids are emotionally, and how you can be attentive to and recognize warning signs and signals of problems in the students that you're teaching, and what you can do in terms of action steps to help them get the help that they need so that they can do as well as they're capable of in the schools and function to the best of their ability. So these are the main points that we'll be talking about in the next few minutes. I'll outline what some of the primary emotional and behavioral concerns are that we are seeing in kids over the past few months. We'll talk about the various risk factors that increase the potential for problems in students. I'll describe some of the warning signs or signals that you can be attending to and recognizing, and then outlining some of the resources that are available to kids for their help. At various points during the webinar, I'll ask you to reflect on some questions that we have, maybe pause the webinar to think about these. A lot of the information that we'll be sharing is really meant to build on or reinforce what you already know about kids who are at risk for emotional and behavioral problems in the traditional classroom. But think about how to apply some of that to our current situation, where most of you are teaching kids virtually or in a hybrid situation where you don't have the same day-to-day in-person contact with your students. So clearly, it goes without saying that coronavirus and the pandemic have very much affected our day-to-day lives. It's caused a lot of disruption. It's led to a lot of cancellations. I think back to the spring. I had one of my kids was a senior at the time, and just the disruption it caused, the things that she and her friends, like many of your students, missed out on. So no end of the year celebrations, no senior prom, no graduation parties. And I'm sure that you can give lots of examples from the students that you've encountered, as well as examples from your personal life where COVID has led to a lot of disruption. Things are not at all the way we are used to or how we want them to be, which is a huge source of stress. The other thing about COVID and this pandemic is that things have been constantly changing. I can't think of how often I've used the term fluidity to describe the way this pandemic has played out and the way we've been asked to respond flexibly and fluidly because of the stresses involved. Another factor that has made this so stressful is that we just don't have, or we haven't had much control over the pandemic. And we really haven't been able to predict when things are going to get back to normal. On top of all this, because of the pandemic, we have been more socially isolated. So the supports that we have that have allowed us to handle and deal with stress more effectively haven't been available in the ways that we are accustomed to having them. So what are some of the concerns that, or some of the problems that we are seeing more of since the pandemic and since all of the disruption to our typical education? Some of the things that we're seeing are increases in anxiety and depression. Kids are clearly more socially isolated than in the past. We have kids with more anger problems, acting more aggressively because of the stress and frustration they've experienced. Increases in family and home stress, kids being at home all the time, parents working from home, parents losing jobs, and the economic and financial stresses that's caused them. Some kids are clearly at greater risk for these problems, and those includes kids who entered into pandemic already with problems with anxiety, depression, and other mental health problems. Kids with a prior history of trauma and loss are at greater risk. Younger students, those who haven't been in school that long, those who don't know how to be successful in school, those who don't have a track record of effective participation in school are at greater risk. And clearly, kids impacted by other factors such as poverty, food insecurity, those who are homeless, kids who are struggling with racial inequities. These kids are also at greater risk for problems during the pandemic. So a first thought question, if you can just take a moment to think about what are some of the factors that would put kids at greater risk for emotional and behavioral concerns during the pandemic? Jumped a little bit ahead of myself here. So some of the things to think about are the fact that there is little everyday normalcy to the student's life during this pandemic. So those traditional schedules or routines of getting up first thing in the morning, getting ready to school, getting ready for school, having breakfast either at home or at the school, the transportation to and from, and every part of the school day as kids and as parents and educators we are familiar with. A lot of kids are not having. I mentioned earlier the limited peer contact that kids have. They don't get to see their friends and acquaintances throughout the day on a daily basis, each and every week. Instead, they are trying to maintain that social contact, mostly through social media, which has been of great use, but is not the same as being around your friends when you would like. Not only have kids had less contact with their peers, but they've also had less contact, if any, with their teachers, with the coaches in the various sports that they played, the instructors in their other activities. They haven't had the same contact with their mentors. They haven't had the same contact with other important adults who can be there to attend to and recognize changes in their behavior, differences in their mood, some of the warning signs and signals that are important to attend to. As well, kids have not had as much access to mental health supports. The school is a huge source of mental health support for kids. Many get their mental health support, their mental health services through the schools, with the schools not being in operation, with kids not attending in person. They haven't had opportunity to get those services. So in your classroom, you probably have some things that you typically attend to, signs and signals that suggest emotional and behavioral issues. What I'd like you to think about is, in a virtual classroom setup, what are the things that might suggest or reflect that a child is having trouble psychologically, that a child's mood or behavior requires some attention? Some of the things that I think are really important to attend to interacting with kids virtually are things like the information that kids are including in their written assignments. So is the information, are the things that kids writing about, the topics that they are concerned with, do they suggest possible sadness, worry, stress? Sometimes as anger becomes more of an issue, what you may find is that students are increasingly argumentative. They don't want to do the work. They're refusing their assignments. They're communicating to you in verbally aggressive ways. All of those may suggest anger problems that need attention. Some kids, when they're stressed, when they're sad, they begin to withdraw. What does that look like? Kids may appear to be zoning out during your classes. They're not there mentally. They may be struggling with memory issues. All of those are suggestive of social or emotional withdrawal. We've talked with kids who during this period of time feel increasingly helpless or hopeless. What does that look like? One sign of that is kids just not turning in their assignments or not doing the kind of work, the quality or level of work that they are typically used to turning in. There may be signs or signals in the communication that you have with kids through email or through the various social media that you interact with them through. So comments made during one-on-one conversations suggesting, again, depression, anxiety, anger. Parents may be identifying concerns that they have about their kids since we went into the virtual teaching mode. Recognize the importance of what the parents are telling you and use those as prompts to take action. Similarly, what kids are posting on message or discussion boards may also suggest that they're struggling and in need of extra support. What you see, what you hear on screen as you're attending to kids may also be suggestive of signs of stress in the home or among family members that may very much impact where kids are physically, emotionally, and what they're going to do educationally in terms of their learning. So if, as you're doing your virtual teaching, you're overhearing fighting in the home, so family members yelling, screaming at one another, screaming at the student, those are things to be concerned about. What a student looks like, his or her appearance, maybe a more disheveled appearance than what you are typically used to, or a concerning home environment that doesn't look like it is organized and is getting the care and attention that it needs. When I get concerned when I hear about kids signing into class but keeping their audio off so they can't interact with you when their cameras are off. What may be going on that they don't want you to see? Are there things at home they don't want you to see or hear? Things that they may be self-conscious about, stressed about. Those are all things to be looking at as warning signs. So again, you may have your suggestions and ideas about what to do when you have concerns about emotional or behavioral issues. Teaching kids normally. What are you going to do? What should you do during this time when most of the work is being done virtually? Some of the things are going to be very similar. So where I would start is if you have concerns about any of your students, reach out to the school nurse, reach out to the school guidance counselor. Though you may not be seeing them on a regular basis, having the same contact or interaction that you typically do. In most school districts, these personnel are still there, are still available. Like you, they are challenged by how to reach out and provide the care as well as they have in the past. But I can tell from our experiences here that the services are there and really wanting to be of help because we know how difficult these times have been. Another good resource is to encourage parents to make contact with their primary care practitioners. Maybe some of the issues are ones that their family physicians or pediatricians can handle on their own, or those practitioners are going to have good access to resources that will be helpful. Mental health counseling may be indicated. If your families are already familiar with the resources out there, you can recommend that they reach out for that. Obviously, if you have more serious concerns about suicide risk or self-harm, the best course of action is direct family members to the emergency room so that they can get the acute attention they require. So this has clearly been a very difficult time for all of us, for your students, their parents and families, you as teachers and educators, and all of us in the health and mental health field. The good news is that recent information or news of vaccines suggests that there is an end in sight to this. But I believe that the next few months are going to continue to be challenging for all of us. Clearly, attention to children's emotional and behavioral concerns, early recognition of these issues, and referral will make a huge difference in preventing problems from becoming more serious. And your early action will go a long way in promoting better behavioral health and wellness. I want to thank you for attending our webinar, and I hope this information will be helpful to you and your students. Thank you.